We are here to do a podcast on reasons to attend a medical conference, as we are currently at a medical conference. I'm Kush Goyal from Cleveland Clinic, joined by a couple of my colleagues. This is Dr. Hanan Saleh, also from Cleveland Clinic, one of our new hires to our group, as well as Dr. Santhosh Thomas, who's also one of our senior faculty at Cleveland Clinic. So I'm going to start with you. What are some of the reasons why you chose to come to this conference?
There are a lot of reasons to come to a conference. One of the most important thing is new acquisition of knowledge. There's a lot of new information that's brought out here. There's a lot of technology that is brought out. So there's opportunities to meet and mingle with your colleagues that you have not seen in a little while. You can share a lot of information with your friends and colleagues and learn what they're doing across the country. Sometimes when you're in a position or in a location where you don't get to spend time with new colleagues or with groups of people who do new things, you may be developing in isolation. So it's always good to share that information with your colleagues and learn from them also.
Excellent. And how about you?
I agree with a lot of the points that Dr. Thomas mentioned. I think also when you come to conferences, you learn the nuances of certain techniques and things that maybe you wouldn't learn in traditional training. I think networking is a big part of it. That always brings me to conference, learning about even my own colleagues, getting to spend more time outside of work and meeting colleagues from around the country. And I think that's always helpful when you have a case that's difficult. It's always nice to know other faculty around the country and how they approach things in medicine. And the bigger kind of skill set that we have, the better treatment we can offer our patients. And I think part of that is widening our network of people in the similar field.
Yeah, those are definitely great common reasons to go. Let's expand a little bit more on networking. So networking, you mentioned among colleagues, but also great to see other leaders or thought leaders in our field. Also, another common thing is, did location play a role?
Yeah, so again, the paramount thing is usually acquisition of knowledge, but location does. Sometimes you go to a new place and you see what is out there in terms of the population that is in the area of the team, how the teams work with the different groups, settings, the rural parts of the country may be different than the city part. One thing that you can see when you go to these meetings is how the research is done and where they're getting their subjects from. It also gives you good ideas and new ideas on doing research for yourself. If you're interested in a certain topic, you may be able to get a variation of the work that was done and probably add knowledge to the science that's already out there. So location does play a factor. Accessibility, a lot of times travel is a little easier to some of the bigger places, but sometimes it's okay to get away from the normal place and go to a smaller area that is not as high on the list of travel to go see or experience.
So I hear also a place maybe to vacation, or maybe a place where you haven't been, or maybe a place where you have some friends or family, so you can also try to visit them as well. And I think also, while we are all physicians, we also have some certifications to go through as well. So I think another reason that we come to here is to get not just education, but also, I think, CME.
Absolutely.
Yeah, there are licensure requirements for all physicians in healthcare and other providers. And each state has different requirements. And yes, going to these meetings helps meet those criteria. Not only that, your subspecialty has requirements also, which may be different than the state ones. A lot of times when you go to these meetings, you can talk to your colleagues and see what they've done to meet the requirements, whether that be a project or number of hours or a service that you're doing. There's a lot of information that can be acquired when you go to these meetings. Working with people in person is very good, and they can, again, you can take them out of the crowd and maybe speak to them privately on some things that you may be interested in. Even it could be a job search that you're interested in that you don't want your employer to know about. That's a nice way to meet up with some people. A lot of times the best jobs are not advertised, and a lot of times there's openings that you don't know about. Going to these meetings can bring that out.
Yeah, actually, I think even one of our recent people who joined our group, we recruited them through a national conference. So it definitely can make some connections or lead to future opportunities for yourself or even for other colleagues. And also with the CME, if you go to a conference that's 2 or 3 or 4 days, you actually can accrue quite a significant amount of CME that you can use for your license. Another thing you had touched on was research. So, for those who enjoy doing their own research or listening to others, you can present your research on the podium, or there's sometimes e-posters or poster presentations. But oftentimes when I hear different topics and I don't hear anything about a certain topic, then I think maybe there's a gap in knowledge, and that might be an opportunity for potentially future research.
You can always pick a few points up every time you go to a meeting. There's some salient points that are out there, how you can present the information to your patients, verbiage in itself, just small little things like that, how you explain a particular injury or a mechanism of recovery. This is all very helpful. So if you pick up a nugget or two at each conference, you'll be more complete in terms of exchanging information with your patients.
I think to touch on that too, some other benefits is that when you do go to conference, there's opportunity to be involved in ways maybe you didn't know prior, and discovering new interest, committees that you might want to be a part of, in ways you can be a more active member in medicine. And just examples of that are committees that maybe are designed to help the underprivileged patient, or working to get procedures covered for insurance companies. And I think when you're actively practicing clinically, being part of these committees helps actually make a difference, because there's a lot of frustration that most physicians can relate to with things not getting covered. And I think these conferences provide that opportunity to figure out ways to get more involved with making change in that arena.
Yeah, that's a good segue to new opportunities or new things in our field. So I think coming to a conference, we can have exposure to new technology, new surgical techniques, new interventions, also even new medications. Sometimes we come across it in the conference, or even just talking to colleagues. Another thing that is you get some exposure to billing and coding. So some things you may not have a lot of experience with in your own practice, you can learn a lot, and that may make your practice more effective and more efficient.
For sure. Definitely an area we don't get through training, absolutely.
There's collegiality also that's available when you meet new colleagues, whether from your old institution, new hires that they've hired, or meeting up with your old friends that you trained with. These are all wonderful experiences. Another thing that we often don't realize is supporting the people who support the conferences, like the vendors who come here with their materials and services. They spend a lot of time and resources in arranging educational needs for us, exposing us to all the new things that are out there. It's always good to support them, have their input, and see if they can be of some value to our patients as well as our knowledge in the future.
So another aspect is, we all work very hard, but sometimes we feel like burned out or kind of overwhelmed, or sometimes work can be a grind. And I think coming to these conferences can also be a great, I want to say, a mental break, or a way to be involved with work but not be actually being at work. And I think that also, at least for me, is very helpful, and also sometimes very inspiring, where you hear about new ideas or new things you want to focus on, both clinically and academically.
Yeah, I like to call a conference kind of a relaxed learning environment, where it's you can enjoy it. It's not like we're in lecture like we were back in medical school, but we're still learning while enjoying our the colleagues' company, and afterwards having social events. So you gain a lot out of it while you're doing serious work, but at the same time finding enjoyment in that as well, which I think is nice to tie in the two through conferences.
Yeah, being in the health field, it's a constant learning, be that from patients or from conferences. It's always a good opportunity to continue with the learning and see where you can be of value to others and of service to others also. A lot of times patients don't realize that we actually are actively seeking knowledge for their betterment. So they know that we're not there at times to meet their needs, but in the long run, we're actually doing better for them all.
Right, that's something that we're told over and over again too, is that medicine is always evolving. We always have to keep up. It's continuing education, really lifelong. And I think the beauty in having conferences is you have that time carved out to do that. Because when you're in the grind of seeing patients every day, it's tough sometimes to do that on a daily basis. And it's nice to have this dedicated time to really gather all that information and advancement in medicine at a dedicated place and location.
Things that I learned when I was in training are not the same things that are available now. There's far more advanced information that's out there. So it's always good to be updated on these things. Technology and knowledge base is always going up. And if you're not actively involved, you may be left behind, and you may be using things that are outdated, and that may be a disservice to your patients.
And other connections you can make are not just to other physicians or practitioners in your field, but also at some conferences there's physicians with different specialties or other professionals in allied health. At this conference, there's a lot of multidisciplinary care being involved. So you can kind of learn what you have in your practice at home, but also maybe how you might want to expand your practice with having more multidisciplinary care, which I think is definitely a goal for all of us, but sometimes it's difficult to achieve when you don't have the resources.
Sometimes you end up seeing things that you thought you were the only one who's seen it, but you may be able to find an expert in these areas. The procedures that you did not think you could do, but they're available and somebody else is doing it, so either you can go and learn from them or have them come show you how to do things if licensure and your institutions can support those things. There's always an opportunity to gain knowledge when you come to these meetings.
Yeah, and I think going along with that, expanding the network of different specialists is also, even within the same specialty, knowing physicians across the country for our own patients. A lot of ours, as we know, come from out of state, from all over, and it's nice to have kind of a go-to person to recommend to. And I think without being able to network like that, it's hard to get to know and trust other providers. So that's another key benefit, I think, to being able to have that networking and that Rolodex of providers that we can offer our patients.
Yeah, I think in this time, a lot of conferences are not just in person, but also virtual, or sometimes some can be in a hybrid version. But again, there are a lot of benefits of going in person. I think, like we talked about, the networking and the connections is something that really is genuine in an in-person conference.
Nothing wrong with the older physicians who have been so used to going to conferences, and the younger generation that does not necessarily need to do that. They're more tech savvy, so they can manage a lot of things. However, if you're not out there, you can't take advantage of some of the things that are out there in person, like labs. There's cadaver labs, anatomy labs, simulation labs, where you can actually have hands-on knowledge, and you can see different techniques on a larger scale. A lot of the information that is shared can be modified by having other colleagues who do similar things, or say, my approach would be a little in this way versus that way. So you can learn from these other physicians who have been out there. There's value in both in person and virtual. The virtual thing is travel time is saved and hotel is saved, but the full experience, the hands-on experience may not be there for you.
Agree. And I think one other thing to touch on regarding conferences is the mentorship that it provides, getting to know faculty and staff that maybe have active roles in committees and in a sense are able to recruit you or expose you to being part of the leadership in these conferences. And so I think the mentorship aspect of it is really nice. And going off of what Dr. Thomas had mentioned, when you do it virtually, it is difficult to form that connection with a mentor. Although still kind of possible, but that's the beauty of coming in person, along with being able to take active role in the skills sessions, because no matter how much we train and do dedicated fellowships, there's always areas for improvement, which the in-person skills lab really helps with.
Yeah, whether you choose to stay in a virtual setting or in person, make sure you take time to learn something new. It's paramount that you serve your patients well down the road, because there's new technology and new information. Every year that I go to these meetings, I pick up one or two nuggets easily that I've used over the last decade or two to help my patients out, along with skills, not just knowledge, but skills also.
Yeah, I think it's great to meet with thought leaders in your field and adjacent fields, and also really to hone our craft. Thank you for listening to us, and I hope you enjoyed this, and hopefully I'll see you at the next conference.